Effects of weight loss in heart failure patients with overweight and obesity, a systematic review and meta-analysis. Published in European Journal of Preventive Cardiology, August 2023. Introduction. Heart failure is a medical condition where the heart doesn't work properly, causing circulatory problems due to structural or functional issues. Despite medical advancements, heart failure remains a major global health concern, leading to high mortality and morbidity. In 2019, there were 56.19 million heart failure cases worldwide. Overweight or obesity is prevalent in heart failure patients, contributing to altered body functions and increased risk factors. Obesity-related complications, combined with major risk factors like hypertension and diabetes, can worsen heart failure. The relationship between body mass index (BMI) and heart failure prognosis is debated, with conflicting findings on how weight loss affects outcomes. The Heart Failure Society of America suggests that heart failure patients with a BMI 35 kilograms per square meter aim for 510% body weight reduction. However, the impact of weight loss on overweight or obese heart failure patients' prognosis is still unclear. This meta-analysis aims to review existing studies globally, focusing on randomized controlled trials and cohort studies, to provide evidence on how weight loss influences mortality, rehospitalization rates, quality of life, exercise capacity, and cardiac function in overweight and obese heart failure patients. The goal is to contribute higher quality evidence for effective weight management strategies in heart failure patients. Methods. Search strategy. Well looked for randomized controlled trials and cohort studies in English and Chinese from database inception to February 1, 2023. English databases included PubMed, Web of Science, Embase, and Cochrane Library, while Chinese databases comprised China National Nuances Lossage Infrastructure (CNKI), Chinese Biomedical Literature Database (CBM), VIP Science and Technology Periodical Database, and Wanfeng Data Nuances Lossage Service Platform. We used subject terms related to heart failure, overweight, or obesity, and interventions like bariatric surgery or lifestyle changes. Inclusion criteria. We included studies that were randomized control trials or cohort studies involving overweight or obese individuals diagnosed with heart failure. The interventions in randomized control trials focused on weight loss strategies, and cohort studies included patients with at least 5% body weight loss. The studies had to measure outcomes like mortality, rehospitalization rates, and quality of life. Exclusion criteria. We excluded studies that enrolled patients with heart failure as a complication, those not overweight or obese. Duplicate data, unavailable full text, animal experiments, non-Chinese or non-English literature, and certain types like conference abstracts or case reports. Literature screening and data extraction. 2 investigators independently screened titles and abstracts with full text evaluation based on predetermined criteria. Data extraction included study details, patient characteristics, interventions, outcomes, and other relevant information. Quality assessment. We assessed the risk of bias in randomized control trials, using the Cochrane tool and cohort studies with the Newcastle Ottawa scale. Study quality was categorized as level A low risk, level B moderate risk, or level C high risk. Statistical analysis, WOOSed Review Manager 5.3 for statistical analysis. Calculating weighted mean difference, standardized mean difference, relative risk, and 95%. Confidence intervals for continuous and categorical variables. We addressed heterogeneity, conducted subgroup analyses, sensitivity analyses, and assessed publication bias with funnel plots. Result. Search outcomes. We begin with 5,779 publications from our database search 4399 in English and 1,380 in Chinese. After removing 759 duplicates and excluding 4,895 irrelevant articles based on titles and abstracts, we had 125 articles for full text evaluation. However, 105 of these didn't meet our criteria. Finally, 20 studies, 19 in English, 1 in Chinese were included for review, involving 449,882 participants. Study characteristic: in these studies, 11 were in the U.S., 2 in Canada, 2 in China, and 1 each in Germany, Britain, Japan, and Spain. 9 were cohort studies, 8 were randomized control trials, and 2 were post-hoc analyses of randomized control trials. All participants were overweight or obese and diagnosed with heart failure. Interventions included bariatric surgery, lifestyle changes, medication, or a combination. 13 studies reported on mortality, 5 on rehospitalization rates, and 8 on quality of life. Secondary outcomes included NIHA functional class and the 6-minute walk test. Study methodological equity. The risk of bias for randomized control trials was assessed, with ROB 2.0 categorizing 7 as low risk and 2 as moderate risk. The Newcastle-Ottawa scale assessed cohort studies, with 9 high quality and 1 moderate quality study. Meta-analysis results. Mortality. No significant difference in mortality between weight loss and control groups was found. Subgroup analysis revealed lower mortality with bariatric surgery, but increased risk with unspecified weight loss modality. Rehospitalization rates. No significant difference overall, but long-term rehospitalization rates were lower with weight loss, suggesting its benefit for long-term health. Quality of life. Weight loss significantly improved patients' quality of life in both short and long terms. NIHA functional class. Weight loss was beneficial, improving cardiac function in heart failure patients. 6-minute walk test. Weight loss resulted in better exercise capacity. Publication bias and sensitivity analysis. The funnel plot for mortality suggested low publication bias. Sensitivity analysis confirmed the robustness of mortality results, reinforcing the reliability of our findings. Discussion. In this comprehensive review involving 449,982 patients from various countries, we sought to discern how weight loss influences the prognosis of overweight and obese heart failure patients. Our analyses unveiled several significant findings. Firstly, bariatric surgery (BS) emerged as a favorable intervention, indicating a notable reduction in the risk of death for overweight and obese heart failure patients. This suggests that BS may offer positive effects such as reducing cardiovascular risk and improving cardiac function. Secondly, weight loss was associated with a decrease in long-term rehospitalization rates, though evidence did not consistently support an impact on overall rehospitalization rates. Thirdly, patients experiencing weight loss demonstrated an improved quality of life, attributed to enhancements in cardiac function, mobility, and symptom relief, enabling better self-care. Additionally, secondary outcomes, including New York Heart Association NIHA functional class and the 6-minute walk test 6-MWT, suggested that weight loss significantly improved cardiac function and exercise capacity in overweight and obese heart failure patients. Comparison with existing literature, our study challenges the obesity paradox, focusing specifically on overweight and obese heart failure patients. Unlike prior meta-analyses that included a broader heart failure population, our research provides targeted insights relevant to this specific group. It addresses gaps in research by expanding the scope to include weight loss's impact on death, rehospitalization rates, quality of life, cardiac function, and exercise capacity. Effects of weight loss on mortality. Regarding mortality, weight loss after BS was associated with a lower risk of death, due to various factors, including reduced hemodynamic load and improved cardiac diastolic function. Conversely, interventions involving medication or exercise did not yield a significant difference in mortality compared to the non-weight loss group. Patients with unspecified weight loss faced a higher risk of death, potentially linked to unintentional weight loss, signaling disease-related issues. Effects of weight loss on rehospitalization. The meta-analysis did not provide substantial evidence supporting a consistent link between weight loss and reduced overall rehospitalization rates. However, subgroup analysis hinted at a potential decrease in long-term rehospitalization rates, suggesting a nuanced impact. Effect of weight loss on quality of life. Weight loss consistently demonstrated a positive association with improved quality of life, highlighting its positive effects on cardiac function and symptom relief. Effect of weight loss on NIHA functional class. Despite conflicting results with previous studies, our meta-analysis suggested that weight loss was associated with improved cardiac function, particularly in overweight and mildly obese heart failure patients. Effect of weight loss on 6-MWT. The analysis indicated that weight loss led to enhanced exercise capacity, aligning with the findings of previous studies and emphasizing the positive impact of weight loss on overall well-being. Limitations. A review has limitations, including combining randomized control trials and cohort studies, limited data on intentional vs. unintentional weight loss, potential confounding factors, and heterogeneity among studies. Additionally, the exclusion of gray literature may have limited the breadth of our analysis. In conclusion, our study contributes valuable insights into the nuanced relationship between weight loss and the prognosis of overweight and obese heart failure patients. The findings underscore the need for tailored interventions based on individual circumstances, and prompt further research to refine our understanding of this complex interaction. Conclusion. In summary, losing weight can benefit overweight and obese heart failure patients by reducing long-term rehospitalization, improving quality of life, cardiac function, and exercise capacity. Weight loss surgery may lower mortality risk. Unintentional weight loss above 5% could indicate health issues. Further research is needed for medication and exercise effects. Tailoring weight loss strategies is essential for optimal outcomes. Any research topics you'd like us to cover next? Let us know in the comments. And as always, like and subscribe.